My name is Geoffroy Sisk, and I'm a plastic and reconstructive surgeon here at Duke Health. In my practice, I see patients with all kinds of reconstructive needs, be that because of congenital defects or traumatic injury or cancer. I speak to them about their reconstructive options in order to try to restore form and function from whatever it is that their ailment is. On the oncologic side of things, the most common things that I treat are breast cancer, head and neck cancers, some orthopedic oncologic conditions that may require reconstruction, and I also treat lymphedema. The most common patient that we see with lymphedema is a breast cancer patient that has had a lymph node resection in the armpit, and that lymph node resection results in a backup of lymphatic fluid within that limb, within that arm, and that backup of fluid causes swelling, which can be deforming but also disabling. Surgical treatment of lymphedema is a relatively new thing, and it's a microsurgical technique through which we can restore that flow of lymphatic fluid out of the limb to try to regenerate, to try to restore form and function to that arm as well. No two patients are alike, and so I think it's really important for me to get an understanding of what the patient's needs are and what their expectations are, and that allows me to tailor my treatment plan to what it is that they're ultimately going to need. In the cancer process, or any injury or any sort of illness, takes something away from you. And the fact that we're able as a specialty to give them that piece back, somewhat changed perhaps, but to give them that sense of identity back again after what can really be a life-changing process in a negative way is really gratifying and satisfying for us as practitioners.